Maintaining mobility and functional movement patterns becomes increasingly important after age 50. While structured exercises are valuable, incorporating fundamental movement patterns can help preserve joint mobility, improve body awareness, and maintain functional capacity. Today we're covering 5 movement patterns that address common mobility limitations: deep squatting, rotational movement, core stability, quadrupedal movement, and hip mobility. These patterns can be adapted to individual capability levels and performed at home with minimal equipment. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new movement patterns, especially if you have joint replacements, severe arthritis, recent injuries, or balance problems. Understanding movement patterns and mobility movement patterns are fundamental ways your body moves during daily activities. As we age, reduced activity levels and repetitive daily movements often limit the variety of movement patterns we use. This contributes to reduced joint mobility, decreased body awareness, loss of movement confidence, and increased injury risk during unfamiliar movements. Reintroducing varied movement patterns can help maintain mobility when practiced safely within individual limitations. The key is adapting movements appropriately and progressing gradually based on your current capability. Movement 1. Supported deep squat for hip and ankle mobility. The first movement pattern is the supported deep squat, which addresses hip, knee, and ankle mobility. Many adults lose the ability to squat deeply over time due to joint stiffness, muscle tightness, and reduced practice of this position. However, deep squatting within comfortable range can help maintain lower body mobility. Here's how to practice supported deep squat safely. Stand facing a sturdy support like a countertop, heavy table, or secure railing at waist height. Hold the support firmly with both hands. Position your feet shoulder width or slightly wider, toes pointed slightly outward. Slowly lower yourself into a squat, going only as deep as comfortable while maintaining balance through the support. Your heels may lift off the floor initially, which is normal. Hold the lowest comfortable position for 5 to 10 seconds while breathing normally. Use your arms and the support to help you stand back up. Rest briefly. Perform 3 to 5 repetitions. Practice 2 to 3 times per week. Important considerations: use sturdy support throughout for safety and confidence. Only squat as deep as comfortable without pain. Partial range is perfectly acceptable. Your flexibility may improve gradually over weeks and months. Keep your chest relatively upright and spine neutral. Don't force depth or range of motion. Modifications: for very limited mobility, perform partial squats holding support. Even quarter squats provide mobility benefits. Place a folded towel under heels if ankle mobility limits your squat depth. For progression, once basic version is comfortable, try pausing at the bottom position and gently rocking side to side to explore hip mobility. What to realistically expect: with regular practice 2 to 3 times per week over 8 to 12 weeks, you may notice gradual improvement in squat depth, reduced hip and ankle stiffness, improved confidence in squatting movements, and better mobility for daily activities requiring hip flexion. Mobility improvements are slow and gradual, occurring over months not days. Movement 2. Seated rotation for spinal mobility. The second movement pattern addresses rotational mobility, which many adults lose due to predominantly forward-facing daily activities. Spinal rotation is important for activities like reaching across your body, turning to look behind you, and many daily tasks. Here's how to practice seated rotation safely. Sit upright in a sturdy chair with feet flat on floor. Sit away from the chair back so your torso can rotate freely. Place your right hand on the outside of your left thigh. Place your left hand on the chair back or armrest behind you. Gently rotate your torso to the left, using your hands for gentle assistance and support. Turn only as far as comfortable without forcing. Hold the rotated position for 5 to 10 seconds while breathing normally. Return to center with control. Repeat 3 to 5 times per side. Practice 2 to 3 times per week. Key points: rotation should come from your torso, not just turning your head. Keep movements slow and controlled, never forcing range. Breathe naturally throughout, don't hold your breath. The stretch should feel comfortable, not painful. Modifications: for limited mobility, rotate only slightly. Even small movements provide benefits. For more mobility, once basic version is comfortable, try the rotation from a standing position holding onto a sturdy support. What to realistically expect: with regular practice 2 to 3 times per week over 6 to 10 weeks, you may notice improved rotational mobility, reduced spinal stiffness, easier turning movements during daily activities, and better flexibility for activities requiring trunk rotation. Spinal mobility improvements occur gradually with consistent practice. Movement 3, Modified Quadruped Hold for core stability. The third movement pattern is a modified quadruped stability position, which challenges core stability and body awareness. This position on hands and knees requires core engagement to maintain proper alignment. Here's how to practice modified quadruped hold. Start on hands and knees on a mat or carpeted surface. Position hands directly under shoulders, knees under hips. Keep your back flat and neutral, not arched or sagging. Engage your core by gently drawing your navel toward your spine. Hold this stable position for 20 to 30 seconds while breathing normally. Rest. Repeat 2 to 3 times. Practice 2 to 3 times per week. Form reminders: keep your back flat throughout, imagine balancing a cup on your back. Distribute weight evenly between hands and knees. Keep your neck neutral, looking slightly ahead at the floor. Breathe naturally, don't hold your breath. Modifications: if wrists are uncomfortable, try the position on your forearms instead of hands. This reduces wrist stress. If knees are uncomfortable, place extra padding underneath. For progression, once basic hold is solid, try lifting one hand slightly off the floor for a few seconds, then the other. This increases stability challenge. What to realistically expect: with regular practice 2 to 3 times per week over 4 to 8 weeks, you may notice improved core awareness and engagement, better body stability and control, improved posture during daily activities, and enhanced foundation for more challenging exercises. Core stability improves gradually through consistent practice. Movement 4, Modified Crawling Pattern for Coordination. The fourth movement pattern is a modified crawling movement, which challenges coordination between opposite limbs while maintaining core stability. This cross-body coordination pattern supports balanced movement and body awareness. Here's how to practice modified crawling safely. Start in the quadruped position on hands and knees on a mat. Keep your back flat and core engaged. Slowly move your right hand forward a few inches while simultaneously moving your left knee forward. Pause in this position. Then move your left hand and right knee forward together. Continue this pattern, moving slowly and deliberately for 10 to 20 seconds. Rest. Repeat 2 to 3 times. Practice 2 to 3 times per week. Important points: move slowly with control. Speed isn't the goal. Keep your back stable and flat throughout the movement. Breathe naturally as you move. Focus on coordination, opposite hand and knee moving together. Modifications: if full crawling is too challenging, practice the movement in place without actually moving forward. Simply lift and lower opposite hand and knee in coordination. For easier version, keep knees on the ground throughout and only practice the arm movements. What to realistically expect: with regular practice 2 to 3 times per week over 6 to 10 weeks, you may notice improved coordination and body awareness, better balance during complex movements, enhanced core stability during movement, and improved confidence in varied movement patterns. Coordination improvements develop gradually through repetition. Movement 5, Seated Hip Mobility Exploration. The fifth movement pattern addresses hip mobility through varied positions. Hip joints naturally move in multiple directions, but limited variety of movement can reduce this capacity over time. Here's how to explore hip mobility safely while seated. Sit on a mat or carpeted floor with legs extended in front. If sitting on the floor is difficult, sit on a folded blanket or cushion for elevation. Bend your right knee and rotate it outward, placing your right foot near your left inner thigh if comfortable. Your right knee falls outward to the side. This is a modified figure 4 position. Hold this position for 15 to 20 seconds, breathing normally. Straighten your right leg and repeat with the left leg. Perform 2 to 3 repetitions per side. Practice 2 to 3 times per week. Form considerations: only move your hip to comfortable range. Don't force rotation. Keep your torso upright and supported. Use your hands behind you for support if needed. The stretch should feel comfortable, not painful. Modifications: if this floor position is too difficult, perform a similar hip rotation while seated in a sturdy chair. Sit near the chair edge, lift your right foot, and place your right ankle on your left thigh just above the knee. This creates similar hip rotation. For those unable to sit on the floor, the chair modification provides similar benefits. What to realistically expect: with regular practice 2 to 3 times per week over 8 to 12 weeks, you may notice gradual improvement in hip mobility, reduced hip stiffness, easier movements requiring hip rotation, and improved comfort during varied positions. Hip mobility improvements are gradual and require consistent practice over months. Creating a movement practice routine: here's how to incorporate these movement patterns into your routine. You don't need to practice all 5 patterns every session. Choose 2 to 3 patterns per session that address your areas of greatest limitation. A complete practice takes 10 to 15 minutes. Sample routine: 2 to 3 times per week, supported deep squat, 3 to 5 repetitions. Seated rotation, 3 to 5 repetitions per side. Modified quadruped hold, 2 to 3 holds of 20 to 30 seconds. Modified crawling, 2 to 3 rounds of 10 to 20 seconds. Seated hip mobility, 2 to 3 repetitions per side. Rotate: which patterns you emphasize based on how your body feels and which areas need most attention. Important safety considerations: these movement patterns support mobility but require appropriate caution. They may not be suitable without modification if you have recent joint replacement surgery, severe arthritis with constant pain, significant osteoporosis with fracture risk, acute injuries or recent surgery, or severe balance problems making floor positions unsafe. Start with most basic modifications and progress very gradually. Stop any movement causing pain beyond mild stretch sensation. These patterns work best combined with regular walking or other activities as tolerated, appropriate strength exercises, and comprehensive healthy lifestyle practices. Monitoring your response: when practicing movement patterns, pay attention to how your body responds. Positive signs include feeling more mobile and less stiff, improved comfort during varied movements, better body awareness and control, and increased confidence in movement capability. Concerning signs include sharp pain during movements, significant increased joint pain after practice, swelling in joints after practice, or consistent worsening of symptoms. If you experience concerning signs, stop problematic movements and consult your healthcare provider. Some mild muscle soreness is normal, but joint pain is not. Realistic timeline for mobility improvements: movement pattern improvements occur gradually. Weeks 1 to 4, learning movement patterns and proper form, initial improvements in body awareness, establishing practice routine. Weeks 4 to 12, movements feeling more natural and comfortable, some noticeable improvements in mobility and flexibility, ability to explore slightly greater ranges. Months 3 to 6, clearer improvements in joint mobility, better movement confidence, established sustainable practice with continued gradual progress. The goal isn't dramatic transformation but gradual sustainable improvement in movement variety and joint mobility supporting daily function. Conclusion: these 5 movement patterns, supported deep squat, seated rotation, modified quadruped hold, modified crawling, and seated hip mobility, provide varied movement exploration that can help maintain joint mobility and functional movement capacity. They address common areas of limitation while remaining adaptable to individual capability levels. Start with modifications appropriate for your current mobility. Practice 2 to 3 times per week consistently. Progress gradually based on how your body responds. Listen to your body and stay within comfortable ranges. These patterns complement but don't replace other important exercises and healthy lifestyle practices. Thank you for watching. For specific concerns about appropriate movement patterns for your situation, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on mobility, movement, and functional fitness for older adults, practical guidance that respects individual limitations while providing accessible approaches to maintaining movement capacity and independence.